So today we are going to discuss about arthritis. Arthritis means joint pain along with swelling. There may be some redness also. Mainly peripheral joint involvement like finger joint or toe joints, or there may be involvement of the wrist, shoulder or hips, ankle, but sometimes there may be also back pain that is involving the spine. And in young individuals, when there is back pain or pain in the lower spine, it may be due to a condition called ankylosing spondylitis. It is very not that much uncommon. It happens in young male or female persons. There may be also, other than spine problem, there may be peripheral joint involvement also. Another cause of joint pain in young individual is also rheumatoid arthritis, which is not uncommon. And there may be stiffness of the small joints of the hands. So when should you go to the physician? If the joint pain is more than 3 to 4 weeks, there is associated morning stiffness of the hands, or there is sometimes other symptoms like red eyes, like oral ulcer or diarrhea. These are the features that are basically red flag signs where one should go to the physician and investigate the cause of joint pain, which is called arthritis. And the common variety of rheumatoid arthritis is symmetrical arthritis, that is involving both the hands along with both the leg joints, along with sometimes maybe pain in the cervical spine, that is neck. So these are the not only affecting the joints, they also affect the internal organs. So one should be very much aware of these things and take proper advice, and timely advice can prevent complications.